Good afternoon, everyone, and welcome to my Friday message. My special guest this week is Dr. Mara Becker, Vice Dean for Faculty in the School of Medicine. As Vice Dean, Dr. Becker was closely involved in the planning and implementation of the Duke Health Integrated Practice. Today we'll speak with her about DHIP, especially concerning some of the exciting opportunities it brings for our faculty. But before we talk to Dr. Becker, I'd like to share a few updates. The North Carolina Department of Health and Human Services reports that hospital admissions and emergency room visits for COVID-19 are on an increase. DHHS reported 435 hospital admissions for COVID in the past week, the highest total since last March. And there's been a sharp increase from the low of 117 in late June. Additionally, wastewater monitoring also shows continuing steep climb in COVID-19 virus particles. Although Duke has not changed its COVID protection protocols, I encourage everyone to take appropriate precautions. If you're at particular risk of significant morbidity, then consider masking in crowded areas. And for everyone, stay at home with respiratory symptoms, including a fever, cough, and fatigue. You should have a very low threshold for testing either at home or via your provider. Vaccination and masking remain the most effective precautions we have against infection. Regarding vaccination, we're awaiting new guidelines for a recommended COVID booster this fall, and we will keep you posted. In exciting research news, the Duke University Health System and School of Medicine are launching OneDukeGen, a precision medicine study that will advance healthcare through cutting-edge research and collaboration. In a partnership with Inference, this study will embark on a journey to unravel the intricate connection between genetics, health, and disease. OneDukeGen will integrate comprehensive genomic data and health information to foster a deep understanding of the hereditary disease susceptibilities. Led by Principal Investigator Dr. Svati Shah, Associate Dean of Genomics, the study aims to recruit over 100,000 consented Duke patients to participate in this pivotal research. In patient care news, I want to congratulate the Duke Health Kidney Transplantation Team, which recently reached a peak milestone of performing more than 5,000 transplants. This is just one of the many reasons to celebrate this team. The program sees complex cases that other health centers may not take on, and they have some of the best kidney transplant survival rates in North Carolina and the United States. Lastly, I want to take a moment to remind you about the upcoming flu vaccination campaign, which launches on Thursday, September 21st. Annual vaccination is the best known protection against flu transmission for patients, their families, as well as faculty, staff, students, and members of the community. Flu vaccination is required for all School of Medicine faculty, staff, students, and volunteers, and clinics will be available at each hospital and at select off-campus locations. So look for more information about hours and locations. Thank you for doing your part to help keep yourself, your loved ones, and our community safe. And now, please sit on my conversation with Dr. Mara Becker. So Mara, thanks for joining me today.
Thanks for having me.
You're one of the many leaders who have been working hard for the DHIP launch, which was successful July 1. So from your view, where are we now?
We're in the fun part, maybe I'd say. I think we can say that last year was hard on a lot of people. It was a lot of work. I'm really, really proud of how people came together and got us over the finish line on July 1st. But indeed, as you can imagine, we realized we have a lot of work to do. And I think, although nothing broke July 1st as we worried about like Y2K, we realized, okay, this is when we really get to work. And we start to see how we can work together to improve our processes and procedures and across Duke Health and optimize the opportunities that we have going forward.
So I think the key word is opportunities. And I think it'd be a big mistake to think that we're done. But just reflecting on the process of getting to July 1. Any takeaways from that?
It was really, I think, an incredible opportunity for growth. People were learning about different processes on both sides. I say both sides, in fact, because historically we operated very differently in our own silos. And so the process of coming together and people being really collegial about that, I think, was something that inspired me along the way. Definitely, it was hard work. It was hard work learning each other's processes and trying to come together quickly in a space that no one had really traversed before. But I think I continued to be inspired by the fact that people kept coming back to the table and kept working through any obstacles that they were faced with.
Now, another area of opportunity just from the process, I don't think we've ever looked so deeply at our policies that affect our faculty and our staff. and really were willing to examine them through the lens of what's best. So you were very much a part of that.
Indeed, and I've had to learn a lot along the way. I mean, faculty historically on the school side, we were managed in a way by the faculty handbook. And that faculty handbook is on the university side. That isn't necessarily congruent with processes and policies on the
I don't know if
health side.
anybody reads the faculty
No,
handbook,
it's
but
terrible.
it's big.
Terrible and boring.
Yeah.
And in fact, I think that was a great process to really, examine that document. The university was also updating it at the same time just to make it a little bit more interesting, and tried to bring it a little bit better aligned with the processes that the health system had. And I think we've done a good job really coming together and working through that. We continue to work through that. It's not done. I think it's just beginning, but it gives us an opportunity to keep going.
I like to think we harmonized our
Yes.
policies
Great word.
and made them make more sense to our faculty and staff, but we do have more work to do for sure there. So we didn't just do this as an exercise, we did it because there really are some opportunities going forward. What do you think are the biggest opportunities?
Well, I look forward to taking advantage of the mega brain trust. I see opportunities for people who are historically on the school side, working with people on the health system side. I think about working with Kevin Thomas in the Office for Equity, Diversity, and Inclusion, and Erica Taylor, who has a leadership role on the health side, and really working towards how we can harmonize searches and hiring practices across the organization and capitalizing on the work that people have done in all of those domains. I think that the collective interest of all those parties are really to further the organization, and I think that only makes us stronger going forward.
So I think from a faculty perspective, the focus on how we recruit, who we recruit, and our strategy for retention has become a lot clearer and I would say a lot more consistent.
Totally agree. And certainly there's a lot of work on the health side thinking about recruitment and retention, and the same on our side. And so why not be able to capitalize on the talents and interests on both of those sides to make more consistent processes across the board and hopefully optimize the work that's already been done. One of the areas that I think I'm most interested in is retention and well-being that we've talked a lot about over the last year while I've been in this role. And we've developed over the next year a restorative justice training program, which has brought in people on the university side, the health side, the School of Medicine side, experts in all of those domains to help teach and hopefully study the way restorative practices might shift and adjust culture. And we get to be a forerunner in that domain, which I'm really excited about. And it was a collaborative effort across the whole system, which I think is a great example of opportunities we have with an integrated system.
Integrated system, simpler organization, hopefully allows us to share best practices and to really have the single approach to many of our challenges that we have ahead of us.
Totally agree, totally agree. It would be incredible to simplify some of the processes that we have historically muddled through, and I think we have the opportunity to do that moving forward.
One of my passions is certainly to continue the integration of our missions in an academic health system. So making sure that our research, our education, our clinical mission, our community mission is all integrated to maximally have impact. I think it's easier in a single organization.
Totally agree. I think one thing I've learned over the last year and really recognize is the interrelatedness of everyone. We need one another to be a stronger whole. When I think about scientists need clinicians, clinicians need scientists, we all need educators, the advocates get this word out to the street and actually move things forward in a more global way. Together in an integrated system, I think we are a much stronger whole than we are individually.
So lots of exciting opportunities.
Yes, indeed.
And for everybody else, thank you so much for what you do and have a great weekend.